A Madison County triple murder trial in its first week abruptly ended early after the defendant changed his plea. Today, Hunter Chenoweth pleaded guilty to killing his mom, Tammy Lynn, sister Cheyenne, and stepdad, James Stanley McGehee. The murders happened 4 years ago, and getting the case before a jury was plagued by delays. Well, this week, the jury saw a video of Chenoweth admitting to an Arkansas State Police special agent that he killed his family. Chenoweth will now serve 3 life terms in prison. We're also learning a man serving a life sentence for the murder of a Fayetteville doctor died in prison. Marcus Joyner pleaded guilty to stabbing his wife, 39-year-old Dr. Amy Phelps, to death at their Fayetteville home almost 2 years ago. So far, it's not clear how he died. ASP is launching an investigation. Dr. Amy Phelps had called 911 about her husband's aggressive and intoxicated behavior right outside their house when he killed her. Friends describe Phelps as a genuine, kind, and true friend to anyone, as well as a very caring doctor. Fayetteville police make an arrest involving a gun at Fayetteville High School today. Officers say that started as a fight between 2 students. One student struck the other with the gun before fleeing the campus. Police found that student off campus, took them into custody, and confiscated the weapon. In a statement sent to families, the school says they take these types of incidents seriously and will follow district safety and discipline procedures to address the student involved. Meanwhile, Fort Smith police say a child hit by a car this afternoon is expected to be okay. It happened on a crosswalk at 24th Street and Tulsa Street. Officers say the driver stayed behind and cooperated with them. Well, the saying goes, breakfast is the most important meal of the day, and Arkansas lawmakers seem to agree. A new bill passed in the state Senate could make sure every student starts their day with a full plate for free. That new law would take medical marijuana tax money and place it into a new food insecurity fund. Director of Child Nutrition Elizabeth Sheremy says this legislation would especially benefit families who tried to apply for the free or reduced meal program but didn't qualify.
It'll help those families not have to come up with breakfast at home. That's more money in their pockets.
The bill will also help bankroll the summer EBT program. According to the U.S. Department of Agriculture, more than 370,000 Arkansas children benefited from this program last summer. Well, that bill is just one of many moving through the legislature right now. It's been a whirlwind of a week in Little Rock once again. Rebecca Brown has a recap of some of the biggest moves.
Governor was back in front of cameras announcing a multi-million-dollar initiative aimed at improving maternal health in Arkansas. While working the Healthy Moms, Healthy Babies Act started last year, there's now new legislation making its way through the Capitol with bipartisan support. The set of bills establish pregnancy-related Medicaid coverage, paying up to 14 prenatal and postnatal care visits. Democrat State Representative Ashley Hudson is one of the co-sponsors of the bill, but says she wants to see more done for mothers across the state.
Obviously, I'd like to see the 12-month postpartum coverage included, but at this point we know that we have a maternal health crisis and we need to be doing something. So I'm not going to throw out good, in search of great.
It was also a big week for another governor initiative. Under the Bell-to-Bell No Cell Phone Act, public schools must have a policy prohibiting students from using their personal electronic device while on school property during school hours. While the bill passed the Senate and now moves on to the House floor, there's still pushback from some lawmakers.
A lot of kids want to remember their memories of that pepper rally, of that homecoming, of that field trip.
This week's work ended with an emotional debate over a controversial bill. Senate Bill 3 looks to end affirmative action. It's made its way to the House floor on Thursday, the spot where a similar bill failed several years ago. Lawmakers eventually approved, putting it one step closer to becoming law, but not without a prolonged back and forth.
To Bentley's point, we need the most qualified people. Those most qualified people may indeed frequently be of that community. But to judge them first based on their race or national origin is a mistake.
Sounds fair in theory, but there's a fundamental problem with this argument. Merit only works as a fair measure when the playing field is already level, and it isn't.
After the vote, Republican State Representative Mary Bentley, who sponsored the legislation, read a list of the things it will change. The word equity will be replaced by equality, the word minority with critical needs. It also gets rid of the Higher Education and Minority Retention Program, and Section 8 removes affirmative action programs.
That was Rebecca Brown reporting there. Well, reaching an underserved part of the community with a life-saving medication. Thanks to a $15,000 grant, that's exactly what the Guidance Center in Fort Smith hopes to do. 5 News anchor Darren Bobb tells us how that money will be spent.
I can't tell you how many stories that I've heard of someone who said, if I would have just had Narcan, maybe my son would still be alive. Or I'm so glad I had Narcan because now my son is still alive and he can enter treatment.
Graham Beatty and Ty Brown are both addiction counselors at the Guidance Center. That $15,000 grant from the State Opioid Recovery Partnership Program has allowed the center to buy 420 Narcan kits to be handed out for free to underrepresented areas in which the center serves.
We're still hitting Logan County and Scott County, Franklin County. We're letting these individuals know that we have this education, we have these tools available for you, and just, knowing is half the battle.
In Sebastian County, 27.8 people per 100,000 die of drug overdose every year. That's the 3rd highest in the state of Arkansas, behind Garland and Pulaski. And for us to have access to this life-saving medication is crucial for families to get better. Bonanza or Hackett or something like. I don't know. If they have a couple of these kits on hand, maybe they save a loved one's life in the meantime while EMS is on the way.
Brown says the Narcan Partnership Program is absolutely working.
Through the ARORP naloxone programs, over 2,000 lives have been saved. Look at how many people's lives we were able to save, whether that's someone who's struggling with addiction, whether that's a child who is at a park and happens to find something under a park bench that turned out to be fentanyl.
Both men say the future of this partnership program is solid.
As long as we are still out here giving people that information and giving people that naloxone, ARORP and the Guidance Center will work together to try and make sure people can have access to that.
I think they're trying to make funds available for the next 20 years. And so we're hoping to be on the front lines of distributing this medication as far as we can.
In Fort Smith, covering news where you live, I'm Darren Bobb, 5 News.
They're doing amazing work. Well, both counselors say if you want to be a part of this Narcan expansion program, just reach out to the Guidance Center in Fort Smith. Well, flu cases are on the rise across the state. In their weekly report, the Arkansas Department of Health says emergency room visits for the flu are rising right now. More than 8,300 cases have been reported since September, while other illnesses like RSV and COVID are circulating right now. They say that the flu is the biggest concern because of the high number of cases, hospitalizations, and deaths. Springdale is looking to put itself on the map as a regional destination for sports tourism. 5 News reporter Jacob Luthi shares more on what the impact could have on the city and how it could benefit young athletes.
The Springdale City Council will soon be considering whether to move forward with the Parks and Recreation Master Plan to make the city a regional destination for sports tourism.
We're not looking to just build new parks everywhere. We have quite a bit of an inventory of athletic fields, whether it's softball, baseball, even basketball courts, volleyball courts. We think we can transform the investments that we've made over the past 2 generations in our city.
Springdale City Chief of Staff Colby Fulfer presented the idea of a new Parks and Recreation Master Plan at a council committee meeting on Monday. He says he wants money allocated to Parks and Recreation to be used intentionally, making sure sports complexes are able to support both local and visiting sports families.
The fans' experience, the experience for mom and dad, grandma and grandpa, friends, family, that goes into concessions, that goes into places for rest, playgrounds for younger brothers and sisters.
Fulfer says the revenue generated from making the city a regional sports destination could help boost the local economy.
The sports tournaments will bring in revenue. We're going to see more people building hotels for this. We're going to see an increase in people gassing up their cars here on the weekends for travel tournaments. They're going to eat at the restaurants here.
But more importantly, Fulfer says if the master plan is approved, he hopes young athletes here at home benefit the most.
We want people coming here to our city. What that's going to do is allow us to raise a whole new revenue that we haven't really tapped into yet to its fullest potential and use that money to make sure that every kid in our city has the best opportunity in our recreation leagues.
In Springdale, covering news where you live, Jacob Luthi, 5 News.
Fulford says he will submit a proposal to the Springdale City Council at their February 17th committee meeting, and there they will decide whether or not to move forward with that master plan.